Welcome to the Living Well Show, where we have holistic conversations that inspire healing, hope, and transformation with your hosts, Dr. Albert and Shanique Tompkins. Hi, I'm Dr. Albert.
Good night. I'm Shanique.
Thank you for joining us, and we hope you all are doing well.
Today, we have a special guest with us, Miguel Ayala. Miguel is the owner of Ease the Pain Massage Clinic in Hinesville, Georgia. He has a 14-year career where he is a licensed massage therapist, and he has helped thousands of persons to achieve pain-free symptoms in their body by helping them restore their wellness goals, maintaining pain-free movement, and just having an overall sense of renewal in their body. He holds a certificate in medical massage practice as well as corrective exercise. He's also a corrective exercise specialist. So we have been in this pandemic for about 18 months or so. And as a result, we have spent more time hunched over our computers, looking over our phones. Our children are on their games. They had to go to virtual learning, which means that they had more screen time. And all of this has caused an impact, we're finding out, on the human body and the posture. So after talking to Miguel, I found out that there's actually a name to the pain that's caused in the shoulder from working on the computer and hunched over the phone. So we have him on tonight to tell us what this is, why our shoulders are so tight, and how to fix it. So good night, Miguel. Thank you for joining us. Go ahead and greet the people.
Good evening. This is Miguel, the licensed massage therapist that you heard so much about just now. I'm thankful to be here and excited to share with you and give you some information on our topic on tonight and give you some good tips on how you can alleviate this problem and stay pain-free.
Awesome. So after talking to you, I learned that little hunch forwardness that we have, our neck is constantly in this position, is called an upper cross syndrome. So go ahead and help our viewers to understand, what is the upper cross syndrome?
Okay, so the upper cross syndrome basically is a postural distortion due to muscle imbalance and is characterized by a forward head posture with rounded shoulders. Basically, the head juts out forward and the shoulders are rounded. To give you a visual, what we would call that today maybe a text neck. You know, you find people texting all the time and their head is down and they're holding their cell phones or mobiles. And it's just that same posture, that slouched forward posture.
Wow, that's really interesting. So tell us exactly what causes upper cross syndrome or UCS?
Well, what causes upper cross syndrome? One of the main causes is poor posture. Now, that's not the only cause, but one of the main causes is poor posture, sitting in a slouch position, constantly doing repetitive motions as far as sitting at desks for long periods of time, working on computers, laptops, texting, typing. But that's not the only way to have upper cross syndrome. People like swimmers, you know, always doing a butterfly stroke can develop the same body type, you know, postural distortion from swimming. Drivers, truck drivers, you know, their hands are always up on the wheel. So those arms are forward, you know, and that can also cause some of the upper cross syndrome. People that love to go to the gym, they want to build up the big chest, the big pectoral muscles, and they neglect the back. So they can develop the upper cross syndrome, that dominant pectoral area, pulling the shoulders forward and creating the imbalance, which eventually will cause pain. Occupations like massage therapy is another occupation that can cause upper cross syndrome. You're
Oh,
constantly
wow.
leaning over the client, and your arms
Okay.
are extended. It's going to bring those shoulders forward. Um, Warehouse workers that are constantly packing boxes,
Yeah.
so any type of repetitive movement that is going to bring the arms forward, that head forward, can cause the postural distortion and create the upper cross syndrome problem.
Wow. Wow, that's interesting. So, when we come to a massage therapist, especially one who focuses on pain management, such as yourself, the average person, we just know we're in pain.
Mhm.
So, how would we know before we come to the therapist, or how would we know that we're dealing with upper cross syndrome?
Well, most of the time you will, if you're not familiar with upper cross syndrome, you will exhibit a lot of the signs and symptoms. And some of the symptoms could be headaches caused
Okay.
by the traps being tight. You can develop pain in the neck from the neck being, the head being extended forward, and the muscles just getting weak and not able to support the neck anymore. Um, you can start having rotator cuff problems, rotator
Mm,
impingement. You may even find it difficult to drive long distances because you develop this pain. Um, a lot of people that come into my clinic, they always have pain in the mid of their back, in between their shoulder blades. And then when I ask them a
mm,
question, what do you do? Oh, I sit at a computer all day. Well, that's one of the key areas that are going to be affected with upper cross. So pain in the mid back, in
okay.
between the shoulder blades. Sometimes people say it's like right underneath my shoulder blade. So
Mm.
that's an area where you'll start to have pain or soreness. And sometimes you have decreased range of motion in your shoulders. Like you'll find it difficult to uh, lift your shoulders over your head because they're used to being rounded and they're not in the proper position to actually lift and do overhead movements. Another big thing is decreased range of motion in your cervical area, meaning you can't turn your head. So
Mhm.
Okay.
if you were to stick your head as far out as you can and try to turn left and right, you'll see how difficult that is. Well, in upper cross syndrome, that's exactly what's happening. Every inch that moves the head forward,
Mm.
you're adding 10 pounds. But when you sit up
Wow.
Really?
straight, yes, when you sit up straight and the weight is supported by the correct muscles, you find that you can turn your head with ease.
Mm.
So that's
Okay.
just one way to signs, well, symptoms to uh, be aware of if you may possibly have upper cross syndrome. And then there are signs too. There are obvious signs, and
Okay.
one of the main ones is the rounded shoulder and the forward head. That's
Okay.
going to definitely be a postural sign that maybe if you took a selfie from the side, you'll see it better than
Ah.
trying to turn
Mm,
to the side, because naturally you won't be lined up. But if you was able to get a picture from the side,
Mhm.
basically what you want to look for is that ear being lined up with the shoulder. And if you drew a line all the way down the side of the body, it also lines up with the hip. When that ear goes past to the front of the shoulder, that means that head is coming forward, as well as the shoulders begin to round as well. Those are signs of upper cross syndrome. And then a lot of times people will have protruding shoulder blades, or what we call winging scapulars. That's another sign that the muscles in the front are dominating the muscles in the back, and they're not able to perform their duty properly. So those are
So
some
those
of the signs.
oh,
Yeah.
sorry. Those protruding shoulder blades, where would you see that at, in the front or the back?
You would see that in the back. So the shoulder blade is the bone in the back of the body.
Oh, okay,
And
okay.
that little chicken wing, it's supposed to be tight to the body, but sometimes it will be sticking out just a little bit. Or,
Right.
depending on how weak the muscles are, maybe sticking out a lot further than that.
Oh,
That's
okay.
that's interesting because as you're talking, I see myself trying to fix my posture, and so I appreciate the signs and the symptoms of upper cross syndrome. And I actually want to know, so at what point should we say, okay, maybe I need to see a professional about this? What although those signs that you're giving us, at what point you say, okay, I need to get help about regarding this?
Well, uh, as soon as you notice that your posture is deteriorating, is the time to seek help as soon as you notice, because the longer it goes on, how the body works, it will take more to undo what has been done.
Wow.
So muscles have memory, and they're going to want to master whatever you're asking it to do. So if they've mastered the slump position, they're going to want to stay in that slump position. So it just means it's going to take more effort on your part to reverse that and get it back into balance. So as soon as you uh, hear this information and you realize you may be on the verge of getting upper cross, seek help immediately. But
Wow.
definitely, if you have pain, seek help for uh, the upper cross syndrome.
Okay.
Okay. Okay. So you shared us the signs, you shared the symptoms. Also, you also shared at what point we should seek assistance. So talk us about treatment. How do we treat the UCS?
So the UCS treatment it can be treated in different ways, but one of the main ways to treat it is through exercise. And in my profession, years in the industry, and taking advanced training,
Mhm.
sometimes we don't get the full uh, treatment to our clients like we should.
Okay.
So just looking at the symptoms and treating the symptoms is not enough. We have to go deeper and get to the root of the problem. So, sometimes you can go and get a massage and you feel better, but you don't do the extra piece. And that's where the exercise comes in. So the treatment, or the problem with upper cross syndrome, is the muscle imbalance. So you have to balance out the muscles. You have a set of muscles that are tight, but then you also have a set of muscles that are weak. So just relaxing the tight muscles by themselves is not going to create a lasting change. You have to relax those tight muscles, but then also strengthen the weak muscles. So some of the muscles that you want to release or relax would be the pectoral muscles, the levator scapular muscles. That's the ones in the back of the neck to, keep your head up. um, you want to relax the upper traps, because sometimes when you're sitting at a desk, you're on your elbows and it raises the shoulders up. So you want to
Mhm.
relax those muscles, which will give some relief, but you
Okay.
want to incorporate the strengthening of the muscles that are not being utilized. So if your pectorals are tight, that means your rhomboids are going to be weak. And
Mm.
this is where the strengthening portion comes in. You want to strengthen the rhomboids, you want to strengthen the mid and lower traps, you want to strengthen the cervical flexors, because they are down like this all the time, and they need to support that head, but they don't have the strength because they're being dominated by the muscles that are being overtaxed, just because of the position that we put our bodies in on a daily basis. So as a treatment, you definitely would like to seek someone that is skilled in, dealing with upper cross stretch syndrome, knows, about kinesiology and movement, how the body is supposed to move in
Okay.
space. So if you seek a massage therapist, make sure that they are on the path of clinical or medical massage, orthopedic type massage, where they're going to go more than just, okay, I'm going to work on this area that you say you have pain, but not look at the whole body as one holistically. You can go to physical therapy. Physical therapists are great at dealing with upper cross syndrome, bringing balance to the body. And then they have corrective exercise, which specializes in correcting muscle imbalance in the body. And
Okay.
oftentimes, corrective exercise is great for people that uh, do have sedentary jobs, that sit a lot and want to start exercising and, increase their overall fitness level. Corrective exercise will help them to first get an assessment to see which muscles are weak, because you can go to the gym, but if your body is not used to doing certain movements, you can actually injure yourself before you even get started. So corrective exercise will assess you and see where the imbalances are, and specifically give you exercises to build those muscles up so you can actually get into a full body routine with less chance of injury. And if you're in Southeast Georgia, you can come to Ease the Pain Massage Clinic, where we
Good.
do the massage and the corrective exercise for the different problems that you may face.
Awesome. And I can vouch that Miguel does wonders when it comes to working on muscles on that table. It is a massage like none other. It's not just your typical, I'm going to relax massage. It is, I went in feeling one way, I come out and my muscles are renewed. So, yes, if you're in the Southeast Georgia area, anywhere down there, Savannah, Fort Stewart, and the surrounding areas, go to Ease the Pain Massage Clinic. All right. So you've told us, you've given us a mouthful of information. I feel like I need to go pull out my anatomy book to relearn all of these muscles up here that are so important and so vital to keeping us moving and functioning. And, I think about the fact that this is so close to our brain. And
Right.
surely, if there's a constriction going on here in our body, it has to be affecting our nervous system and the flow of fluids up and down our spinal cord. So, this information is awesome. Once we have uh, worked on this upper cross syndrome, we've gone to a good therapist, they've given us some corrective exercises. What can we do to avoid falling into this upper cross syndrome again in the future? What are some of the things that we should be doing to stay in good posture?
Well, it's important to do the things that the professionals have given you to do. And I see oftentimes people will say they have an injury or something, and they will go to physical therapy. And as long as they're going to physical therapy, they are diligent in doing their exercises when they go twice a week, 3 times a week, however long they go. But then when they get released or they finish, they get complacent, they stop doing the exercise, and they end up in my office. And I asked them, well, did you continue to do what the physical therapist said? And they said, no. So I would say, to avoid it, once you realize or you have had your upper cross syndrome experience, be mindful of the things that uh, helped you to get over it, and be mindful of your posture. Be mindful of the position that you put your body in, especially if it's going to be for a long period of time. I mean, I've had people that come in that are experiencing pain, and I began to ask a couple of questions. Come to find out, they love to read. Reading is great, but they're reading in their bed. Their head is piled up on
Mm.
pillows, and they're holding their book in front of them. Well, guess what that's
Wow.
doing?
Wow.
Creating that pattern. So I had a couple of people, hey, I know you love to read, but how about you sit up in the bed? Just change your position. So uh, be mindful of the position that you are putting your body in. Is probably one of the biggest things you can do to avoid the upper cross syndrome. And then if you work at a desk, take those pauses. I know we can't quit our jobs. We need the income that it provides for our families. But if you want to enhance the quality of your life, take 30 seconds to do a couple of stretches. And if you've already had it, you know what stretches you need to do. You can take 30 seconds and do a quick stretch. Stand up. If you sit down, maybe have a stand-up desk where you can stand up for a little while. Your legs get tired, then you sit back down. But try to incorporate, different pauses throughout your day, that you're not stuck in the same position for hours upon hours. um, Another thing you can do is, as you are, looking at your mobile or your tablets or your computers, make sure that your desk is set up in a way that you can look straight at it, instead of having to look left or right or up or down. Have it at a level where you can look straight in front. Uh, I had a client one time. She came in, and she had a problem. She came in, she was doing good. Then she came back. She said, "This pain is coming back." I said, "Well, did you change anything? Did you get a new position or whatever?" She said, "No." And she thought about it. She said, "You know what? I changed my computer. I put it on the side." I said, "You looking right at it?" She said, "No." I said, "Well, when you get back to your office, put your computer back." She did it, and but these little things,
Little things.
make a big difference in how the body's going to respond, because the body is set up to operate in a certain way, and when it has to uh, deviate from that, it can create some cascading effects and begin to cause pain. So definitely, I would say, make sure your workspace or wherever you're working is comfortable, to where it's not putting you in a slouch position, a humped over position. If you're going to be reading, try to bring the book up to eye level. If you're going to be texting or looking at, things, bring it up to an eye level that you don't have to be looking down. And then the last thing I would say is just do the corrective exercise. Now, I do massage therapy, and I can tell you it's easy to fall into bad body mechanics and just, grind through. It's easy to fall into that. But I purpose, when I became a corrective exercise specialist, I purpose that when I go, and do my exercise, I'm going to do the corrective exercise that I need for my occupation. Every occupation
Mm.
has its hazards, right?
Yeah,
And
that's true.
mine is going to be the rounded shoulder, the lower back, because there's also a lower cross syndrome as well.
Okay.
That's another topic.
Yeah,
But
because
I
we're gonna
have
get
to
back
make
to that one.
yeah,
Yeah, exactly.
yeah. But I'm mindful that I don't want to look like a older person, and I'm still young, so I have to do the corrective exercises that I need to do to keep balance, that I can, have a full career doing what I love, massage therapy, and helping people to feel better. So, one of, if I can give you one exercise to do, I would recommend the seated row, where you really
Mm,
squeeze those shoulder blades together as you're pulling back. Keep
okay.
the elbows tucked into the body, pull
Mm-hmm.
back and really squeeze those shoulder blades together, because that's going to open up the pectoral muscles, but it's also going to strengthen the muscles behind you. And those are tips that you can use to uh, avoid the upper cross syndrome from taking over and causing you pain.
Wow,
Wow.
that's some great information. Some great tips, some great exercises, and you raised a good question. I know you said that it is connecting to your head, to your head, to your brain. So I'm wondering, just curious. I wonder if UCS impacts your mood. It impacts your emotions because you're so hunched over. You may not even realize it. Have you found anything like that, Miguel?
What I've found is when people are in pain, it absolutely affects their mood,
Mm,
because now they can't concentrate, their focus
mm,
is not where it should be,
mm,
because they're dealing with painful movement. And we're not supposed to have pain while we're in motion. Our body is designed to be fluid and work together as a single unit. But
mm,
if I have clients that are not able to comb their hair, because it hurts to put their arms up long enough to do, the what it takes for them to do their hair, or they're tired of taking medicines to mask the pain that they're feeling in their shoulders. They don't know what to do. So it absolutely affects the mood when you have pain in your body, no matter if it's a toe pain,
mm.
a hagnail, or any type of pain. It does affect your mood. And once the pain is gone, it lifts you up. Sometimes people will leave out of the office and they'll say, I came in here and I had a headache, but my headache is gone. And you can just see the life return back to them, because now that
Wow.
blood is flowing through the muscles the way it should. And blood is, it's healing. It's healing for the body.
Right.
That's good. Wow. Great information. Because in terms of living well, that's what we desire this show to provide information regarding and impacting your overall health. I guess another question I have is, over the years, because you've been doing this for some time now, are you seeing an increase in cases, or are you seeing people being more aware of this particular issue?
Well, the upper cross has been around for, well, it's been around for a long time.
Mm,
In 1988, Dr. Vladimir Janda, he is what gave it a name, the upper
okay.
cross syndrome.
Okay.
But basically, it's just the characteristic of the forward head, rounded shoulder posture. But I will say I've seen an increase in clients coming into the clinic with pain,
Mm.
and it was due to working from home. So
Ah.
Mhm.
before COVID, there were people that would come in with neck and shoulder pain. They had office jobs and things like that. But working from home has increased the amount of people coming into, our facility for help. But another thing I have seen, and I'm sure you've seen it too, if you just look around, is the younger population.
Mm-hmm.
They are exhibiting upper cross at young ages, but they're
Wow.
always on their phone, texting, looking at YouTube and all types of videos. So I'm seeing younger people that may not be experiencing the pain part of it, but definitely the posture is deteriorating fast. So I
Wow.
have seen, where this corrective exercise is vital, to have, if technology is going to be in the world, it's convenient, but we have to combat the negative effects with it, through corrective exercise, and being mindful of our posture and how long we spend, on devices and in certain positions, and do the necessary things uh, to combat that. Sometimes people come in and say, well, what's the best position to sleep in? The position that you can get some sleep in, right? But if you lay with your legs curled up, when you get up in the morning, you need to what? Stretch those legs out. So to bring that balance back in, because if you're not getting any sleep, the body's never going to recover anyway. So if your occupation demands you do this, spend the time to bring balance to it by doing the reverse.
Awesome.
Great, great, great. Well, I guess anything else any lasting words you want to leave with us before we close out the show?
Well, I just want to say thank you for having me on this show. It is very, I'm very passionate about, you know, educating people on things that they can do for themselves. A lot of people want a quick fix, and they turn to medicine, but this is something that everyone can do. Whether you have a gym membership or not, you can do some exercises to uh, help you to feel better and to help you to move through space, pain free. So I'm just glad I had a couple of minutes to share um, some of my expertise with the public.
Yes, it's been valuable. We've definitely learned a lot about the upper cross syndrome. We may not have known what it was called, but I'm sure that we've all definitely seen, or maybe even have it in our body, that forward head, slouch shoulder posture. And with us working from home for almost 2 years and who knows how much longer, it is vitally important that we become aware of the syndrome so that we can do those corrective exercises and take those measures that you spoke of so that we can have longevity in our body. We don't want to survive COVID and then our body breaks down because of the muscle use or the improper muscle use. So it was invaluable information. I'm sure the community will benefit for years to come from what you shared. And we will have to get you back on to talk about the lower
Right.
portion of the back, because I know that that's another area that many persons struggle with, low back pain and hip pain. So, Miguel, you have been a valuable resource for us on the Living Well show tonight. We thank you for your time, and we do look forward to having you again. And Dr. Albert, go ahead and close us out.
Okay, well, thank you all for joining us today on our show. We really appreciate our guest, Miguel, sharing his in-depth expertise in this area. We hope you all learned something today that will help you be better, do better, and to live better. We'd love to hear from you. In fact, let us know how you're going to implement some of the suggestions that he gave us regarding exercise and posture, and if you're going to follow through with it and be mindful, as he said, regarding your health in terms of the upper cross syndrome. Remember to like, share, subscribe, and review this episode. And we look forward to seeing you again next week, right here on the Living Well Show. God bless and good night.
Good night, everyone.
Good night.